Hello, everyone, and welcome to Rehab Podcast Weekly. Today, we're diving into the topics tennis elbow, diagnosis, and intervention.
Okay, let's talk about that nagging pain on the outside of the elbow. Tennis elbow.
hmm
It's incredibly common, right? Like, you hear crazy stats, up to half of tennis players get it at some point.
Yeah, it's really prevalent. But it's not just athletes, you know?
Right. That's the thing. We see it in painters, plumbers, people working on assembly lines, cooks.
Carpenters, butchers, auto workers, anyone doing those repetitive forearm movements.
Exactly. So today, we wanted to really dig into it, understand what's going on, how it's diagnosed, what the treatment looks like.
And definitely talk about bracing and some specific exercises.
Yeah, and prevention too. We've pulled together insights from, solid sources in physical therapy and orthopedics.
Sounds good. And just to clarify, the name tennis elbow is the common term, but clinically we often call it lateral epicondylitis.
Right, that's the one you might see on a chart, maybe with the code M77.1.
Precisely. It all points to that spot on the outer elbow.
So, lateral epicondylitis. What's actually happening there in simple terms?
Okay, so you have that bony bump on the outside of your elbow. That's the lateral epicondyle.
Mm-hmm.
Tennis elbow is basically damage to the tendons that attach to that bump. These are the tendons from the muscles that pull your wrist and fingers backwards into extension.
And is there one specific muscle usually involved?
Yeah, the main one we focus on is the extensor carpi radialis brevis, or ECRB for short.
ECRB, okay.
And the damage usually isn't from one big injury, but rather tiny, repetitive stresses,
Hmm.
micro tears.
Ah, okay, so like repeated backhands in tennis or using a screwdriver all day.
Exactly. That constant gripping and wrist extension puts strain on the ECRB tendon attachment. Over time, these micro tears happen, and the tendon can actually start to break down, degenerate.
Degenerate. So it's not just inflammation. I think most people assume it's tendonitis, like simple inflammation.
That's a really common misconception. While there might be some inflammation initially, the chronic issue is often what we call angiofibroblastic hyperplasia. Basically, think of it as disorganized healing. The body tries to repair, but it lays down immature tissue with lots of weak blood vessels instead of strong, healthy tendon fibers.
So it's less about putting out a fire inflammation and more about like rebuilding a weak structure.
That's a great way to put it. And understanding that helps guide how we approach treatment, especially for longer-term cases.
Interesting. So besides the jobs we mentioned, painters, plumbers, cooks, are there other risk factors? Age.
Yeah, it tends to be most common in people between 30 and 50.
Okay.
And sometimes, honestly, it just develops without any obvious repetitive activity. We call that idiopathic. It just shows up.
Right. So if you start feeling that outer elbow pain, how do you know if it is tennis elbow? What are the classic symptoms?
Usually it starts gradually. You'll feel pain or maybe a burning sensation right on that outer elbow point.
Hmm.
Sometimes that pain can radiate down the forearm, too. And a really common thing is weakened grip strength.
Like dropping things or finding it hard to open a jar.
Exactly. Or even just holding a coffee mug can be painful. It often gets worse with forearm activity, and sometimes it can ache at night.
And usually in the dominant arm.
More often than not, yeah, because that's the arm you typically use more for those repetitive tasks.
Okay. So someone comes in with these symptoms. How do you, as a therapist or doctor, confirm it's tennis elbow? What's the diagnostic process?
Well, it really starts with a good clinical exam. We look at the elbow first. Is there any obvious swelling or redness? Usually not much with tennis elbow.
Okay.
Then we palpate, meaning we gently press around the area. There's usually a very specific point of tenderness, typically just slightly below that main bony bump, the lateral epicondyle.
Right over the tendon attachment.
Exactly. If pressing there reproduces your main pain, that's a strong sign.
And then you check movement.
Definitely. We assess range of motion, elbow bending and straining, forearm rotation, turning the palm up and down, wrist
To
movements.
see if anything is limited or painful.
Right. And then muscle testing. We resist certain movements. A key one is resisting wrist extension, asking you to bend your wrist back against our hand, usually with your elbow straight,
Okay.
or even just resisting you lifting your middle finger up. If doing that causes that specific pain at the lateral epicondyle, it's highly suggestive of tennis elbow.
I feel like I've had that done before. Are there other specific tests you might use?
Oh yeah, there are several. We might passively stretch the wrist extensors by gently bending your wrist downwards with your elbow straight.
Ow, yeah, I can imagine that would hurt if it's inflamed.
Right. Or the chair test, trying to lift a chair with your arms straight, palm facing down. Pain there is another positive sign.
So lots of ways to provoke the symptoms in a controlled way.
Exactly. There are others too, like the Bowden test, Thompson test, Mill test.
Yeah.
They all aim to put specific stress on those extensor tendons to see if it reproduces the pain at the epicondyle.
It sounds like the physical exam is pretty thorough and often points right to the diagnosis.
It really does. In most straightforward cases, the history and physical exam are enough.
So things like X-rays or MRIs aren't always needed then.
Not usually for a primary diagnosis, no. An X-ray might be done sometimes, maybe to rule out underlying arthritis or a bone spur, but it's often normal in tennis elbow.
And MRI.
MRI gives a much more detailed look at the tendon itself. It can show the extent of the degeneration or tearing. It's more often used if the diagnosis isn't clear, if symptoms aren't improving with standard treatment, or if we suspect something else might be contributing.
But what else could mimic tennis elbow?
Well, sometimes neck problems, like a pinched nerve in the C6 or C7 level, can refer pain down to the elbow area.
Ah, cervical radiculopathy.
Exactly. Or you could have arthritis in the radial head, which is part of the elbow joint near the epicondyle, or even radial nerve entrapment near the elbow.
So you need to rule those out.
Right. The exam helps differentiate, and sometimes imaging or even an EMG, a nerve test, might be needed if nerve issues are suspected.
Okay, so let's say you've confidently diagnosed it as tennis elbow. What's the game plan for treatment? You mentioned most people get better without surgery.
That's the good news. Somewhere between 80 and 95% of cases resolve with non-surgical care. The first, and maybe most important step, is relative rest.
Meaning, stop doing the stuff that hurts.
Pretty much. You need to decrease or modify those activities that aggravate the pain, at least for several weeks, to give that tendon a chance to calm down.
Makes sense. And pain relief, just standard over-the-counter stuff.
Yeah, things like acetaminophen or NSAIDs, ibuprofen, naproxen can help manage the pain and maybe some initial inflammation, though we know it's often not purely inflammatory.
Okay. And then physical therapy comes in.
Absolutely crucial. PT is where you learn how to address the root of the problem. The muscle imbalance is the tendon health.
What does that involve typically?
It involves specific exercises, which we'll get into, for strengthening the forearm muscles and improving flexibility. Therapists might also use modalities like ultrasound, ice massage, or sometimes electrical stimulation to help with pain and healing.
Got it. What about those straps, the counterforce braces people wear? Do they actually help?
They can, yeah. That strap goes around the forearm muscles just below the elbow. The idea is it changes the line of pull on the tendon attachment, reducing the stress right at the painful spot.
So it kind of absorbs some force?
Kind of, or redirects it. Research, like meta-analyses, suggests they have a small to moderate effect on reducing pain during activity for some people. A wrist splint, especially worn at night, can also help by keeping the wrist extensors in a rested position.
So helpful, but maybe not a magic bullet.
Exactly. Part of the overall management plan.
What about injections? Steroids are common, right?
They are. Cortisone injections can provide pretty good short-term pain relief because they are strong anti-inflammatories.
I sense a but.
Yeah. The but is that the relief might be temporary, and there's concern that repeated steroid injections could potentially weaken the tendon tissue over time. So they're usually used judiciously.
Are there other types of injections being used now? Like PRP?
Yes, platelet-rich plasma,
Oh.
PRP. That involves drawing your own blood, concentrating the platelets, which are full of growth factors, and injecting that concentrate back into the damaged tendon area.
Trying to stimulate a better healing response.
That's the theory. Some studies show promise, especially for cases that haven't responded to other treatments, but the evidence is still evolving, and it's often not covered by insurance.
Okay. And things like shockwave therapy, ESWT.
Extracorporeal shockwave therapy. It uses sound waves directed at the tendon to try and stimulate healing. Again, some studies show benefit, others are less conclusive. It's considered a bit more experimental by some.
Right. And for athletes, checking their equipment.
Definitely, especially in racket sports. Racket stiffness, string tension, even grip size, making sure those are appropriate, can reduce the stress on the forearm. Technique is huge too, of course.
Good point. What about hands-on therapy, massage, mobilization?
Manual therapy techniques like soft tissue mobilization, joint mobilization, maybe muscle energy techniques, they might be helpful as part of the overall plan, perhaps improving mobility or reducing muscle tension. But high-quality evidence specifically proving their effectiveness for tennis elbow alone is a bit limited compared to exercise.
Okay, so it seems like exercise is really central.
It really is. A structured home exercise program is usually recommended right from the start.
What does that look like initially when it's still pretty sore?
In the early phase, the focus is usually on gentle range of motion. We want to maintain movement without increasing pain. So things like slowly bending and straightening the elbow. Turning the forearm, palm up, palm down, pronation and supination. And gently moving the wrist through flexion, extension, and side-to-side deviation. Just aiming for symmetry with the other, unaffected arm, and staying in a pain-free zone.
So keep things moving, but don't push into pain.
Exactly. Then, as the pain settles, we start progressing to strengthening.
How does this start? Light weights.
We often begin with isometric exercises first.
Where you tense the muscle but don't move the joint.
Right, like pushing your wrist up against your other hand or against a table, holding the contraction for a few seconds without actually moving. It helps activate the muscle without stressing the tendon too much.
Okay, isometrics first, then movement.
Then we move to isotonic exercises, contracting the muscle through a range of motion, usually with light resistance, like a small dumbbell or resistance band. And this is where eccentric exercise becomes really important.
Eccentrics again. Remind us that's the lengthening part.
That's the one. When the muscle is working while it's getting longer. For the wrist extensors, that would be the motion of slowly lowering your hand back down after lifting it up against resistance.
Why is that so key for tendinopathy?
Research suggests that eccentric loading helps to stimulate collagen production and remodeling within the tendon in a more organized way. It seems particularly effective for chronic tendon issues like tennis elbow, helping reduce pain and improve function.
So focus on that slow, controlled lowering.
Very much so. It's often a cornerstone of the exercise program.
Can you walk us through a few specific examples, like that wrist extensor stretch?
Sure. For the stretch, hold your affected arm straight out, elbow fully extended, palm facing down. Use your other hand to gently press the back of your hand down, bending the wrist towards the floor. You should feel a stretch along the top of your forearm.
Hold for like 15, 30 seconds.
Yep, 15, 30 seconds. Repeat a few times. You can do the opposite for the flexor's arm, straight, palm up, gently bend the wrist down.
Okay, and the strengthening, that wrist extension one.
Right. Sit with your forearm resting on a table or your thigh, wrist hanging off the edge, palm facing down. Hold a light weight, maybe just a soup can to start. Slowly lift the weight up by bending your wrist back. That's the concentric part.
Okay.
Then, and this is the key, very slowly lower the weight back down over maybe 3-4 seconds. That's the eccentric part.
Got it. Slow on the way down. And you do the same palm up for wrist flexion.
Exactly. Same setup, but palm facing up. Curl the weight up, then slowly layer it down.
What about grip?
Grip strengthening is good too. Squeezing a soft stress ball or a hand gripper. Hold for a few seconds, relax, repeat.
And forearm rotation.
For that, you can hold a light weight, like a hammer or a dumbbell held on one end, with your elbow bent at 90 degrees and resting on a surface. Slowly rotate your forearm so your palm turns down, pronation. Then slowly rotate back so your palm turns up, supination. Keep the motion controlled.
Those sound like really targeted exercises. Anything else to consider in rehab? Like the rest of the arm?
Oh, absolutely. It's crucial to look beyond just the elbow. We call it looking at the kinetic chain.
Meaning how everything is connected.
Yeah. We need to assess and potentially address issues in the shoulder, the scapula, shoulder blade, even the neck and upper back, and core stability. Weakness or poor movement patterns elsewhere can put extra stress down at the elbow.
So fixing your shoulder posture might actually help your tennis elbow.
It definitely can. A comprehensive rehab program looks at the whole picture, not just the painful spot.
That makes a lot of sense. Okay, shifting gears slightly, how do we try and prevent this from happening in the first place?
Prevention really comes back to understanding the risk factors and modifying them. If you're an athlete,
Racket sports especially.
yeah, focus on proper technique. Get coaching if needed. Make sure your equipment, racket size, string tension, grip is right for you, and always warm up properly before playing.
And for the occupational risks, the painters, the carpenters.
It's about ergonomics and work habits. Can you modify how you do the task? Use tools that reduce vibration or require less forceful gripping. Can you take frequent breaks to stretch your forearms? Avoid prolonged periods of forceful gripping or heavy lifting, especially with the wrist extended.
So awareness and modification.
And maintaining good general strength and flexibility in the forearm muscles is key for prevention too. Doing some of those stretches and basic strengthening exercises regularly, even when you don't have pain, can build resilience.
Like prehab.
Kind of, yeah. And maybe using one of those counterforce braces proactively during activities might put your elbow at risk could be considered.
Okay, that's a lot of great info. So summing it up, tennis elbow, that lateral epicondylitis, is super common, usually from overuse leading to tendon degeneration, not just inflammation.
Right. Diagnosis is often clear from a good physical exam.
And treatment, mostly non-surgical rest, modifying activities, PT with a big focus on those eccentric exercises.
Braces and sometimes injections can help manage symptoms, but exercise is really the foundation for long-term recovery.
And prevention involves smart technique, proper equipment, ergonomic awareness, and keeping those forearm muscles strong and flexible.
You've got it. It really highlights how understanding the biomechanics of what we do every day, whether it's sport or work, is so important.
Definitely. It makes you wonder, doesn't it? How many aches and pains could we potentially avoid if we just paid a bit more attention to how we move and maybe made some small adjustments along the way? Something to think about.
Edited by Min. Rehab. Thank you all for listening, and see you in the next podcast.